Good day, I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is your daily medical tidbit. As I stated yesterday, I will keep talking about electrolytes. Yesterday I spoke about hypokalemia, which is high potassium. Today I want to shed light on phosphate. Phosphate. And it's overlooked. You know, you hear about magnesium, calcium, sodium, but we don't talk about phosphate. And phosphate is a form of phosphorus, right, found in the body. Very, very vital mineral. And where do you find phosphate? In bones, teeth. As a matter of fact, about 85% of it is found in bones and teeth, right? It's also in the cells that, in your body, all right? And it works together with calcium and vitamin D to maintain healthy bones, and it plays other vital roles. And so why do we need phosphate? Bone and teeth I talked about, right? It combines with calcium to form hydroxyapatite, the mineral that makes our bone and teeth strong. So that's important. And those of us in the medical or the science field know that phosphate is energy. It's needed for energy production, right? Energy is represented as something called the ATP, adenosine triphosphate, right? That's the body energy currency. Without phosphate, you cannot store or use energy properly. So that to me is very, very, very important, right? Cell function for DNA and RNA structure, helping cells divide and grow, just is very, very important. All right. It also acts as a buffer in the blood for your acid balance to keep your pH within a certain range. Okay, and also for your muscle and nerve function, contraction, nerve signaling, and things like that. So it's important. Phosphate is important. We don't talk about it, but I'm bringing it to you. So what are some of the signs of phosphate deficiency? Hypophosphatemia. It is very uncommon, just know that. But it can occur in cases of malnutrition, alcoholism, uncontrolled diabetes, right? And if you're taking certain medications like diuretics or even antacids, but it's the antacids with aluminum that binds the phosphate, okay? So remember that. Weakness and fatigue, these are vague, but loss of appetite, irritability, you get very irritated very easily, right? And if you have severe deficiency, bone pain, fractures, right? And in children, you can develop what's called rickets. Again, very, very uncommon, right? Gradual muscle weakness, and again, that's in the severe deficiency. Difficulty breathing, because your diaphragm and your intercostal muscles and everything else that helps you breathe needs the phosphate to function, right? And if you have severe phosphate deficiency, your immune function is also affected. So you start seeing, more infections and things like that, right? And the extreme deficiencies, you can have seizures and irregular rhythm and even coma. Okay, I want to end by talking about some of the foods that are rich in phosphates. All right, it's abundant. It's abundant in many foods, especially protein-rich ones. All right, so in animal sources, all meats: beef, pork, chicken, fish, salmon, tuna, sardines, eggs, dairy products. All right, in plant sources. Remember, for the animal sources are highly absorbable. The plant source is a little more difficult to absorb, but still very beneficial. Nuts, it's almonds, peanuts, cashews, seeds such as pumpkin seeds, sunflower seeds, sesame seeds, okay? Legumes, like the beans, the lentils, the chickpeas. Whole grain, oats, whole wheat bread, brown rice, all right? Try to avoid the processed foods. As I always say, they're absorbable, but not the healthiest choice. So when you're out there shopping and you're looking at the processed food and you're reading in the back and you see phosphate, you got to look at everything else, the sodium, the potassium, etc., etc. These things are not good. All right. So just understand that most of us get more than enough from our diet, right? But balance is important. If you're an alcoholic, if you're a bad diabetic, and all these things, you have to be careful, right? Too much phosphate from processed foods can harm your kidneys and your bones, especially if your calcium is low. Okay, all right. So phosphate is important for strong bones, your energy production, and healthy cell function. And even if deficiency is rare, you have to be aware and educated on these things. Just continue with good dietary exercises, right? And you can go from there. All right. So just remember that phosphate is important. All right. This is Dr. Dangleben on behalf of Patient Choice. Have a great day. Peace.